This non-communicable diseases kill around 41 million people each year, and it is amounting to around 74% of all the deaths that is happening globally. First of all, I would like to thank the chairperson for her kind introduction. Thank you, the organizing committee, for giving me this platform to speak on this topic. Although this is a very vast topic, the first thing that was told to me was make limited slides and try to cover it within 20 minutes. I now start my topic regarding impact of lifestyle-related illnesses on sexual function in women. So I will be just telling you about what are these lifestyle diseases. Most of it is known to you, but we just brush up as to what all are the common lifestyle-related diseases that are commonly prevalent. Risk factors, the modifiable risk factors, then coming to the most common type of NCDs, magnitude of the problem that lies in the society, classification of the female sexual dysfunction and its association with the NCDs, and then the most common presenting manifestations amongst our patients, lifestyle modifications, and at the end, the management of FSD. So what are these lifestyle diseases? Can anyone tell me what is lifestyle? What is your definition of lifestyle? Yeah. Yeah, lifestyle is something that one chooses by himself or herself. It's a way of life that one chooses to be. So it is a complex interaction of multiple things put together. So it is acquired, it runs over a period of time right from early age, and it is conditioned by various things like familiar, economic, educational, and the social environment that you come from. So these lifestyle-related disorders are a result of inappropriate lifestyle habits with respect to the environment in which they live. So India, of late, has shown that 61% of the deaths that occurred in last year were around because of only non-communicable diseases in particular. So India has been seeing an upsurge of non-communicable disorders for the last few decades. Until now, these disorders were actually known as Western diseases, diseases of affluence and things like that. But no more, it is now only limited to the Western world, but we are now slowly acquiring them much more than what they are. So it is now more prevalent in the lower as well as the middle socioeconomic strata, as well as in developing countries. So to give you a figure, by 2030, the proportion of total global deaths that can occur due to chronic diseases is expected to be anywhere going to increase up to 70%, and the burden on us is going to be 56%. So this is the need of the hour that the government and the policy makers take a look on this problem. The thing is, the awareness is not very much present amongst us. So what is the association between the lifestyle resulting or amounting to sexual functioning is not really known. All that we know is lifestyle-related disorders cause X number of diseases, but it also affects the sexual functioning in an individual is not really known. And I am a practitioner in rural Bangalore, where I come from. And what I understand is, yes, although in our urban literates are there, they do understand, some do practice healthy lifestyle. But in the rural area, it is still very much, the awareness is really very, very poor, wherein, they clearly do not understand the association of these medical disorders amounting to sexual dysfunction. So most of them amounted to psychological cause itself. So instead of going to a physician and ruling out the organic causes, most of them are brought in first place to us. It should be reverse the order. First, it should be the organic causes should be ruled out, what all are the comorbidities that coexist, and then the patient has to be referred to a psychiatrist. So what all are the lifestyle related factors? It is the lack of physical activity, the dietary factors, that too much of consumption of high carbohydrate diet and the junk, sedentary lifestyle, alcohol and other substance of abuse, and tobacco smoking. So the WHO has given a list of 10 most commonly prevalent chronic diseases or non-communicable diseases that we call. The first in line is the cardiovascular diseases, which includes coronary artery disease, the hypertension, and then comes cancers, various types of cancers, type 2 diabetes, and chronic obstructive pulmonary disease. I'm going to limit myself to these 4 set of most important causes. The facts that each one of us must know, this non-communicable diseases kill around 41 million people each year, and it is amounting to around 74% of all the deaths that is happening globally. So cardiovascular diseases followed by cancers, then COPD, and followed by diabetes. So these 4 group of diseases almost they amount to almost 80% of all premature deaths. And non-communicable diseases can even start from early childhood as well. So what all are the characteristics of these non-communicable diseases? One is the complex etiology. It is because of early globalization, then urbanization, and then population being aging, and multiple factors like genetic factors, the hereditary factors, the gender, so many things playing a complex role, along with the novel risk factors also that are involved. Multiple other risk factors. So it is not that just one risk factor is going to cause X disease. It is a multiple interaction of too many risk factors put together. Then long latency period. So it takes few years, few months to many, many years. So it runs a long course. So it's chronic by nature, non-contagious, then prolonged course of illness and functional impairment or disability. So amounting to quite a bit of mortality as well as morbidity. So the risk factors for non-communicable disorders, as you all mentioned, it is high blood pressure, abnormal lipid levels, tobacco use, physical inactivity, obesity, unhealthy diet, and desk jobs and stress-related work. That is what we have been coming to know of late. In fact, even during Corona, most of our IT friends were, they were sticking on to their desks, and most of them have put on a hell lot of weight, obesity, metabolic syndrome, and recently they have been into many types of non-communicable set of disorders. So the non-modifiable risk factors include age, heredity, gender, as well as ethnicity. Novel risk factors which are very much particular to one particular disorder. Like for example, excess of homocysteine in the blood as an inflammatory marker is very much present in vitamin B12 deficiency. Also in case of many vasculitis, you see abnormal blood coagulation, that is elevated blood levels of fibrinogen. So vasculitis also is one of the most important causes, which includes even rheumatoid arthritis as well as osteoporosis. Now, sedentary lifestyle, I've just given an overview of what all diseases that it can cause. It causes CVD, depression, obesity, poor quality of life, osteoporosis, fatigue, diabetes, and frailty, amounting to stroke as well as falls. Again, poor dietary habits. There is an overlap of all types of diseases put together. In addition to that, it also causes metabolic syndrome, diseases of the liver as well as the gallbladder. Then you can see obesity as an independent risk factor can also cause endocrinal disorders, obstructive sleep apnea, osteoarthritis, in addition to the diseases that I mentioned earlier. Alcohol consumption, yes, in long term as well as short term. In long term use, yes, it causes a lot of neuropsychiatric disturbances in the form of cerebellar degeneration, there is amnesia, then going into dementia. There is a lot of fetal damage whenever someone is, when a lady is pregnant, risk of violence, and slow cognitive decline is what is seen, associated to a lot of other mood disorders as well as psychotic disorders. Coming to the tobacco, yes, active smoking results into a hell lot of diseases, including lung cancer, coronary artery disease, COPD, stroke, type 2 diabetes, going into eye diseases as well as rheumatoid arthritis. Even passive smoking, inhalation of the smoke that has come from someone else smoking is also equally detrimental to one's life. It can result into multiple types of cancers. So all of you, do you believe can lifestyle diseases cause sexual dysfunction? How many of you agree? Glad to know that. So what is female sexual dysfunction? I will not go into the details of it. Multiple times it has been told. So WHO defines female sexual dysfunction as the various ways in which a woman is unable to participate in a sexual relationship as she would wish. So this is a slide which shows you about, as Rao sir was mentioning about DSM-5, the classification, the latest classification that we have. Female sexual interest or arousal disorder, female orgasmic disorder, genitopelvic pain or penetration disorder. Then what all are the common symptoms and signs of female sexual dysfunction? One is hypoactive sexual desire or loss of desire for sex, inability to achieve orgasm or inadequate vaginal lubrication before and during intercourse, vaginismus, then vulvodynia, that is pain during intercourse, and non-coital sexual pain disorder. Coming to the first and foremost important disorder, that is cardiovascular diseases and female sexual dysfunction. There are quite a bit of review articles that have come from Western population, but there is a lot of scope for Indians to study separately female sexual dysfunction in patients suffering from cardiovascular diseases. So the data which is available is very limited, I would say, when it comes to female sexual dysfunction. There are a lot of studies that have been done on diabetes and male sexual dysfunction, but still the data that is available on females is very, very limited. So as I come from an institutional background, so this can always be taken up as a topic for research in the near future. Even if you are doing that's really good thing. Try to publish it as much as possible, because the data that I tried to look into, it is all from the Western world itself. So cardiovascular diseases represent a multiple risk and predictive factors for FSDs. So it is a systemic vasculitis. So there is a compromise of blood supply to the arteries. So because of atherosclerotic plaques. So what happens is the blood supply is very much reduced even to the vaginal arteries. So this being one of the reasons for causing female sexual dysfunction. So it also amounts to decrease in the woman's sexual desire. In few of the studies, it has also shown that there is decreased sensitivity in the clitoris as well as the vaginal labia as well as orgasm. And some of them even presented with lubrication difficulties and pain during the sexual intercourse. So one more thing that I came across all these studies in systemic review is that depression has been one of the comorbidities that has been there along with the patients with coronary artery disease, as it goes even with cancers or let me say type 2 diabetes mellitus. So the sexual dysfunction that has taken place in a client could be because of the underlying depression as well. You need to look into the mental health aspects also when you are dealing with a patient who has come to you with cardiovascular disease. It is not just you look into the heart aspect of it and the other aspect of it is not looked into. So you need to independently assess for whether the patient is suffering from depression. One more thing, after treating the depression, again antidepressants amount to, as sir said, around 80% of the patients end up having female sexual dysfunction. So it is in the follow-up that you also see the patient in terms of drug-induced sexual dysfunction has to be ruled out. So in first place, you take a normal history, do the general physical examination, systemic examination. Also along with that, try to collect the sexual history aspect of it and call the patient for a follow-up, and then try to find out whether is it the cause or the effect. This becomes a little tedious although, but it has to be put into practice. depression itself can result into loss of libido or loss of desire, as you very well know. It can also reduce the erotic focus in an individual and thus impairing the sexual response cycle. Coming to multiple types of cancers and sexual dysfunction in women, see, cancer itself per se has prognosis-wise the course that it runs and the medications that the patient is to be on, the treatment modalities is entirely different, including the time that the patient actually presents to you with. So invariably when the patient comes to you, it is very difficult once the diagnosis has been laid for the patient to accept that he or she is going to, has to be on such and such treatment. This is a kind of disease, because cancer is still lying as a stigma in most of the places. So it is very difficult for the people to understand that, okay, I can come out of it. So that positive attitude towards the disease, one does not develop immediately. So it takes quite a bit of time to make the patient even understand. So that anxiety and depression, both these comorbidities are very much common again with cancers. So cancer per se results into all sorts of negative feelings and psychopathologically, biological and social symptoms such as denial, anger, fear and fatigue. It also comes in the way of one's sleep as well. So most women are sexually active, but because what happens is, if one partner is also suffering from a chronic disease like cancer, which has got very high morbidity and mortality, then it becomes very difficult for the other partner to generate interest. So this is one aspect of it. The most frequent sexual dysfunctions which were noted were reduced desire, arousal and orgasm. Then coming to diabetes, female sexual dysfunction can be an presenting manifestation of the disease itself. Most of the times, it is just one clinical symptom that the patient might come to you, but that might hint you saying that, okay, there might be impaired glucose levels in her body. So you should always evaluate for the same. And diabetes mellitus is one of the most common cause of sexual dysfunction. So as per WHO, it is expected to reach around 629 millions of people are going to be diabetic by 2045. So it results in lubrication difficulty, again decreased sexual response, decreased sexual desire, sexual activity may be reduced, which may impact a woman's relationship with her partner. So I've given you the list of wherein it gives you the multiple pathophysiological reasons as to why a lady develops sexual dysfunction who is a known diabetic. Okay, the reasons being hyperglycemia, repeated UTIs, having again pain in the vagina and not allowing for sex. So all the penetration difficulties and all these other set of infections, vascular complications and so on. Then COPD, yes, COPD also results in most of the patients again develop anxiety, depression and osteoporosis. All these set of individuals are also likely to have sexual dysfunction in the form of decreased sexual drive. Now, evaluation and treatment, I will just brush you through it for some 2-3 slides. It is, as Sir said, multiple times history, history and history. So a detailed sexual history taking must happen whenever a patient has come with any sexual dysfunction. Application of appropriate scales whenever necessary. Detailed assessment using doing both local examination as well as systemic examination. Mental status examination if at all it is necessary. Pharmacotherapy, yes, there are vaginal gels, vaginal moisturizing creams available, estrogen creams are available. There are dilators that are being used for, for pain-related vaginismus or so. Then exercises, Kegel's exercise, which will increase again the bladder musculature and the tone of the particular area, and that can improve one's sexual health. So I'm not going into the details of psychotropic-induced sexual dysfunction. That is the topic of our workshop, which is happening on Sunday in detail. Okay, those of you who are interested can please attend. And the next thing is lifestyle modification and counseling or supportive therapy from professionals. These are few of the things that you need to look into. Weight reduction especially, attain and maintain a BMI of less than 25 kgs per meter square. dietary salt restriction of anything less than 6 grams of sodium chloride, then adapt a diet which contains low of carbohydrate, more in fiber content, less of sodium chloride, but more in, again, potassium, calcium, and magnesium. Even if it contains a diet which is rich in B3 and B6, have been found, even L-arginine has been found to be very, very useful for improving the sexual dysfunction, including consumption of alcohol to be cut down to less than 2 drinks per day for in case of men, and less than 1 drink per day in case of women, and good amount of physical activity, that is about 7,000 steps 5 days a week, or doing aerobic exercises. So restful sleep, meditation, yoga, and good coping mechanisms to reduce stress in today's world. These 3 things are also equally essential for one to have a peaceful life, I would say. Then, can anyone tell me in what way sex benefits you? Are there any benefits onto your health? Can you tell me few, sir? I made your job easy. Yes, 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 sir. So sex itself is a natural way of deriving pleasure. So that is one activity which naturally gives you a high or pleasure. So the key message that I would like to give you today is, which I took it from sir, the theme, sex is pleasurable, don't make it miserable with unhealthy lifestyle. So sex itself is quite rewarding. So see that, you don't do anything that, amounts to sexual dysfunction, especially because of your unhealthy lifestyle. So I just wanted to, through this, I just wanted to establish an association between having something unhealthy and resulting into sexual dysfunction among the crowd. Okay, thank you.
Hello. A disclaimer and declaration. You might be feeling, अरे डॉक्टर गदरे बार बार आके क्या सुधार है, खुद को दिखाना है क्या, कितना आता है. Please don't misunderstand me. That is not my intention. या शाइनिंग या फ्लैम्बॉयंसी है क्या? नहीं, वो भी इंटेंशन नहीं है. इंटेंशन ये है कि जितना पता है वो आपको दे दे, ताकि ज़्यादा से ज़्यादा आप लेके जाए और क्लिनिक और खुद के लाइफ में अप्लाई करें. तो भली बात या सच्ची मीन्स मेरे माँ के कोरोनरी आर्टरी के खून की कसम. ओके, तो अभी ज़्यादा क्या बोलूँ, सच्चे दिल से बोल रहा हूँ. सो नाउ व्हाट आई वांट टू से इज दैट सी इन फिलोसफी एंड ऑफ कोर्स इन साइकोलॉजी ऑल्सो व्हाट वी डू एंड इन लाइफ इज विच एंटोनियो ग्रामची नाम का है, टू टर्न द आइडिया हेड ऑन. माने पूरा उल्टा घुमाना, जैसे आइंस्टाइन ने न्यूटन को घुमा दिया. तो नॉट दैट आई एम टर्निंग योर आइडिया अराउंड. I personally have a feeling, and I'm testing it, that it is many a times that the sexual frustration gives rise to lifestyle problems. I would like to know from Sajdev doctor, he being a diabetologist also, and as a contribution I am saying, that we should tell the newer generations of students and the physio and I mean the physicians that how many times whenever there is a blood pressure, diabetes, cholesterol, metabolic syndrome, X, ये वो आप पूछते हैं tobacco, alcohol, कि are you doing this or drinking because are you having a sexual problem? And many a times at least men come out of that कि अरे भाई मैं शराब में डूबा हूँ क्योंकि मैं वीर्य में डूब नहीं सकता, because my wife is not interested. So many a times I feel that the sexual frustration gives rise to huge amount of stress in life, which will give rise to lifestyle disorders. And asking this history is extremely important, which हमको सब सिखाया गया ना कि ब्लैडर, बॉवेल, एपेटाइट, स्लीप कैसी है, तेरा सेक्स कैसा है. And always remember that instead of asking, ask patients that, do you enjoy tobacco? Do you enjoy alcohol? The word enjoy gives the message, doctor is open for communication. And then he will come out. So do you enjoy क्या? Whiskey, vodka, rum, beer, wine क्या?
Sir.
हाँ.
Sir,
Yes.
We have to,
Thank you. So please,
May I share?
Yes, sir.
As a diabetologist, I always inquire with my patients about sex life. But males, I am not yet able to open that discussion with female patients. So if you could throw some light on that. Because it's very difficult to open that topic when the patient is female. and especially when they've come alone. So it's a very challenging thing.
Yeah. Now, sir. Now, sir.
We will have the discussions after as we are running out of time. Please, let's. I invite Dr. Ajit Pradhan sir to felicitate Dr. Veda ma'am.